All right, today we're diving into a pretty high-stakes showdown. Artificial intelligence going head-to-head with one of medicine's biggest challenges, cancer. A brand new study put some of the most advanced AIs through what was basically the ultimate medical exam. And, well, the results are both a huge step forward and a major reality check. When you're talking about cancer treatment, every single decision is absolutely critical. For the doctors out there on the front lines, having the most up-to-date information can literally be the difference between life and death. It's a field that moves unbelievably fast. But that's the huge problem, right? With thousands of new studies and drug approvals coming out constantly, how can even the absolute best, most dedicated oncologist possibly keep all of that in their head? It's just a total information overload. And this is where AI is supposed to be the hero. So a recent study decided to put this whole idea to the ultimate test. Researchers took different types of AI and threw these complex, real-world cancer scenarios at them. And what they found, let's just say it was not what anyone was expecting. Okay, so first up, let's meet the contenders in this showdown. Because as this study makes really clear, not all AIs are built the same. They looked at 3 totally different ways of tackling this medical challenge. First, you've got your general-purpose LLMs. Think of things like OpenAI's OB1 and Google's Gemini. The best way to think about them is as a closed-book exam taker. They have this massive amount of information that they've essentially memorized during training, but they can only answer based on what's already inside their head. Next up is something called Retrieval Augmented Generation, or RAG for short. The system they used here, called Milo, is more like an open book exam taker. So it's not just relying on its own memory. It can actively go and look up information from outside sources, kind of like a digital medical textbook, to find the latest and greatest facts for its answer. And finally, we have the most advanced competitor in the ring, the agentic workflow. The study tested an AI called Hope AI, and this thing acts like a PhD researcher. It doesn't just look stuff up. It actually uses multiple tools. It can reason through a problem in multiple steps. It can plan, it can execute tasks, and pull together information from all over, almost like a real research assistant running a whole project. So we have our contenders. But how in the world do you design a fair test for an AI that's supposed to act like a doctor? Well, the study they designed was this incredible gauntlet. First, experts came up with 50 real-world clinical situations for a very complex blood cancer called multiple myeloma. Then, they had the AIs generate detailed treatment plans. And here's the really brilliant part. 3 independent human oncologists scored every single answer without knowing which AI wrote what. They graded them on everything: accuracy, how thorough they were, and even if they were actually ready to be used in a clinic. So after all that grading, the numbers came in, and the data showed a massive performance gap. There was, without a doubt, a clear winner. Let's start with accuracy, because that's what really matters. When the expert doctors rated the answers, the agentic AI, Hope AI, was judged mostly to completely accurate 82% of the time. That is a huge leap over the standard LLM and the RAG system. And that performance gap gets even widened when you look at how complete or comprehensive the answers were. The agentic AI's answers were rated mostly to completely comprehensive 74% of the time. The next best was way, way behind at just 36%. So that ability to do multi-step research really paid off. But maybe the single most telling stat is this one. When the human experts just ranked all the AI answers from best to worst, they picked the agentic AI's response as the #1 choice a staggering 2/3 of the time. I mean, that is just a dominant performance. So, the agentic AI crushed the exam. Case closed, right? Well, this is where the study delivers its most important lesson, the big reality check. Because it turns out winning a test isn't at all the same as being ready to treat patients. Which brings us to the biggest question of all. After a performance that impressive, is this winning AI actually ready to start treating people? And the answer, and this is really the kicker, is in this one number, 25.3%. That was the highest score any of the AIs got for being ready for clinical use without edits. Just let that sink in for a minute. Even the winning AI's answers needed a human doctor to review and edit them almost 75% of the time before they were considered safe enough for a patient. So what went wrong? Well, the expert evaluators found 4 key problems that kept popping up across all the AIs. They would sometimes miss brand new therapies.
They'd get the official FDA-approved treatment guidelines wrong. They recommended old and outdated drugs, and they just didn't think through the sequence of treatments properly.
And to make this really concrete, here is a serious example from the study. Some of the AIs recommended a drug called belantamab mafodotin. The problem? That drug had already been pulled from the market. This is the exact kind of dangerous error that shows why human oversight is still absolutely essential. All of this really leads to the study's main takeaway. We need to completely reframe how we think about these tools. The future isn't about the AI doctor. It's about the AI assistant. The study's authors put it perfectly in their conclusion. They said, model outputs should be treated as decision support rather than directives, with review by qualified clinicians prior to any real-world use. In other words, the AI doesn't get the final say. It's an incredibly powerful tool to help an expert make an even better, more informed decision. So the goal here isn't to replace doctors, it's to empower them. The AI can do the heavy lifting, sifting through mountains of data in seconds, and that frees up the doctor to use their experience and their judgment with the best possible information at their fingertips. And that leaves us with the real question for the future. How do we design the best possible partnership between these human experts and their powerful new AI assistants?